Let's have an honest conversation about psychiatry. These are not just academic questions, they're the real concerns that patients and practitioners grapple with daily. My personal history when dealing with psychiatry and psychology is one of gaslighting, followed by brainwashing, and then further gaslighting. In December, my friend Dr. Jacqueline Moskow compiled a list of these thought-provoking questions. What if we could compel every psychiatrist on earth to answer these questions? The questions are not just theoretical, they cut to the heart of modern psychiatric practice and patient care. Let's explore what practitioners might reveal if they answered with complete transparency in these categorized questions. What percentage of your patients are truly thriving on their prescribed medications? How often do you successfully reduce or eliminate medications? How many medication combinations and dosage adjustments does it typically take to find the right fit? What determines which side effects you discuss with patients? What systems do you use to track adverse reactions after prescribing a medication? How do you distinguish between medication side effects and underlying condition symptoms? What's considered an acceptable amount of weight gain from psychiatric medications? When prescribing lithium, how do you weigh brain benefits against kidney risks? Do you have a preferred pharmaceutical company? If so, why? Do you have a preferred pharmacy chain? What drives this preference? How thoroughly do you review FDA summaries for new medications? Should doctors have access to raw clinical trial data? Are cognitive fog, insomnia, and fatigue considered serious enough to address? Is emotional numbness preferable to sadness? Do you discuss PSSD or post-SSRI sexual dysfunction risks when prescribing SSRIs? How do you address withdrawal symptoms before starting medication? How do you incorporate psychosocial, cultural, and spiritual factors in your treatments? Have you tried dietary changes as a first-line treatment? What's your approach to discussing the gut-brain axis? What lab tests do you run before starting a medication? What's your medication approach for pregnant women and children? How do you handle potential medication-induced gender dysphoria? What's your perspective on grief duration? How do you approach mood changes in relation to menstrual cycles? Has the chemical imbalance theory's discrediting affected your practice? Do any DSM diagnoses remind you of horoscopes? How often do you revise or remove diagnoses? Are psychiatric labels ultimately empowering or disempowering? What percentage of your patients have died by their own hand after starting a new medication? What's considered an acceptable rate of such outcomes? Have you inadvertently contributed to substance use disorders? How did people cope before antidepressants? These questions challenge us to think deeply about mental health care's future. They're not meant to undermine the field, but to strengthen it through honest examination and continuous improvement. What's your experience with psychiatric care? Share your thoughts and experiences. Your voice matters in this crucial conversation about mental health treatment's future. Have a great day, and I'll be back soon. Bye.